Hello there. Today I will be talking about the human immunodeficiency virus, also known as HIV. HIV has dropped in mortality and morbidity today. It is still the leading cause of death in underdeveloped countries. Now that we have more information on how HIV is spread, we can prevent it and treat it better. In 2016, approximately 36.7 million people were infected with HIV, and about 19.5 million of those people were being actively treated with antiretroviral therapy, also known as ART. There was an estimated 1 million people who died from an AIDS-related illness in 2016. In 2015, HIV was listed as the 9th leading cause of death for the age groups of 25 up till 44 years of age. 38,500 new HIV diagnoses in the United States in 2015. The population of people that have the highest rate of HIV are gay and bisexual men and men who have sex with other men. This population represents about 26,200 of the new diagnosed HIV infections. The 2016 budget for domestic HIV and AIDS prevention and research at the CDC was $788 million. This is all information from the Centers for Disease Control listed under 2018. Next, let's talk about the etiology of HIV. It is a mutation of the simian immunodeficiency virus, also known as SIV. SIV was identified in a chimpanzee located in Central Africa. Hunters that were hunting the monkeys were infected through the infected monkey's blood. The primary ways that HIV is transmitted are through sexual contact, intravenous drug use, or perinatally. At one time, there was a risk of getting HIV from blood transfusions. Our blood today is much better screened so that the possibility of getting HIV-infected blood is extremely low, but there is still a risk. Next, moving on to the pathogenesis of HIV. HIV is a virus that attacks the body's immune system, specifically the CD4 cells, also known as the T cells. Since the CD4 cells are a part of the immune system, the body can no longer fight off infections. There are 3 phases of the HIV infection: the primary infection phase, chronic asymptomatic or latency phase, and overt AIDS phase. In each of the next slides, I will talk about some of the clinical manifestations that occur throughout each phase, since each phase is very specific. The primary infection phase. This is the beginning phase of HIV. There is usually a slight sickness that can be compared to influenza or mononucleosis. It usually lasts for a few weeks and occurs about a month after being exposed to the disease. Viral replication is at its highest. The CD4 and T cell count takes a major hit. While trying to get over this acute infection, the body fights the virus. This is when people start to get like the flu and start to look sick, and then they eventually just get over this illness. After the acute phase, we move on to the chronic asymptomatic, or also known as the latency phase. There are really no signs or symptoms of the virus at this time. This phase usually lasts for about 10 years. The CD4 cell count continues to fall gradually, but not as drastic as the first phase. Some patients may experience swollen lymph nodes, also known as PGL. The final phase of HIV is the overt AIDS phase. There are a couple requirements to technically be in the AIDS phase. A lot of people think that you have HIV/AIDS, but there's actually a phase in HIV. The requirements to be in the AIDS phase: the CD4 cell count is less than 200 cells, or the person has an AIDS-defining illness, and that is also known as like an opportunistic infection. Having a CD4 cell count less than 200 puts a person at a great risk for getting opportunistic infections. Some of the common opportunistic infections are toxoplasmosis, herpes simplex virus, candidiasis, pneumocystis jirovecii, cytomegalovirus, HPV, B-cell lymphoma, Kaposi sarcoma, and AIDS dementia. Most individuals diagnosed with HIV will develop AIDS 10 to 11 years after getting the primary infection. There is treatment for HIV, but there is no cure. The prognosis of HIV infection primarily depends on when treatment is started. Treatment is then based on the complete picture for the patient and how much of the disease had progressed. One of the most effective treatments of HIV is antiretroviral therapy. That consists of 5 different medications. They pick these medications based on the patient's cell count and how far along they've had this infection. As HIV affects the entire world, there are a lot of implications for nurse midwifery practice. Like I said, there is not currently a cure for HIV, and preventative care is a priority. Preventing the spread of HIV by using condoms and safe sex practices is very beneficial. Perinatal HIV transmission, also known as mother-to-child transmission, can happen at any time during pregnancy, labor, delivery, and breastfeeding. The CDC recommends that all pregnant women take an HIV test early in pregnancy to be diagnosed and treated effectively. If a woman takes the ART therapy throughout her pregnancy, labor, and delivery, and gives the HIV medicine to her baby for 4 to 6 weeks after delivery, the risk of transmitting HIV to the baby can be as low as 1% or less. Here are a few final words on HIV. The rate of HIV is decreasing in the world, which is great news. At most times, the spread of HIV is very preventable. Abstinence, limiting the number of sexual partners, and never sharing needles and using condoms correctly can decrease the risk of spreading HIV. If you or one of your patients currently lives with HIV, there are many ways to prevent passing it to others. It is most important to get tested early and diagnosed with HIV, then immediately start taking the antiretroviral therapy. This way you can prevent spreading it to others and to your babies. These are my references I used. The Centers for Disease Control and Prevention website was very, very beneficial. Thank you.